budding physician, upcoming physician. Welcome to you, Dr. Sumant.
Thank you, Vishen.
Yeah, and thank you all the members for joining this session. Over to you, Dr. Sumant.
So let's begin with Dr. Sriram Gubbi. So he'll tell us about his journey and how we approached the residency application and USMLE altogether. So over to you, Dr. Sriram.
Okay, thanks, Saman. Sachin, just so that we don't overlap, what are you going to talk about?
So I'm just going to talk about how USMLE is, what are the steps, how to approach, and then some statistics on NRMP match.
Okay. Okay. So yeah, I think I have about 10 minutes. Okay, fine. So I think the rest of you, if you can just mute, that would be better, so that there will be no echo. I matched in 2015. So I started preparing for USMLE back in 2013. I basically had plans to do PhD in biochemistry, but I did not do that. I just decided to do medicine. So I graduated in 2013, and I cleared my step 1 and step 2 in 2013 and 2014. And you have to do mandatory rotations in US before you apply for residency. So I also did that in 2014, and in late 2014, I interviewed in different places, and the match happened in 2015. So typically, after you graduate, you need at least 1 or 2 years to match in a US residency program. I did internal medicine residency. So that lasted for 3 years. It was from 2015 to 2018. And then I did my endocrinology super specialization. So that lasted from 2018 till June. So I finished in June, then I became an assistant professor at National Institute of Health. I also did my fellowship in National Institute of Health. I did my residency in Albert Einstein College of Medicine in New York. Yeah, it's called Jacobi Medical Center. That's one of the hospitals of the university. So for me, the clinical experience here in US, it's definitely different from India. Now, I can't vouch for how different it is for all places because I trained in a government hospital, and you know how government hospitals are. One, they are too busy, and two, you don't have any good facilities to manage patients. So it was quite challenging. And the duty hours too, especially in medicine, we used to work for like 40 hours straight with maybe 3 hours of sleep in between. And we had lots of admissions coming in during internship in my medical college, Bangalore Medical College. But in US, such stringent hours used to exist, but now they don't exist anymore. The max you work in a day is maybe 25 hours at a stretch. But then again, those stretches won't be as bad as how it would be in a government college in India. You won't get 40, 50 admissions in a day. You always have a cap, which means you can't go beyond a certain number of admissions every day. So in that way, you're protected. And honestly, because my internship in BMC was so brutal, despite my first year of residency being actually really busy, it didn't get to me. I was used to much worse situations in BMC. In fact, I think I hit the nadir, I hit the bottom when I went back to the makeshift doctor's lobby sleeping lounge in BMC. And there was a street dog sleeping on my bed. I was so tired, I had to shoo the street dog and go to sleep on that. So yeah, I didn't have to do that here, so thankfully, but otherwise, I think in clinical aspect, things are a bit, I would say, easier yet complex in US because in India, not many places use electronic health records. So in India, if you are working in a government hospital, you might know that like patients come in, stretcher after stretcher, they're like, oh, he's unconscious. Oh, I don't know, he's acting weird. Or, oh, look, she's talking trash to me. You don't know what's happening to these people. You don't have their records. And if you ask them, okay, what tablet your father was taking, they'll show, oh, it was this. They show some peeled up piece of blister pack, so you don't even know what they're taking. Now that usually does not happen in US because almost all hospitals have electronic medical record. So if someone comes in unconscious and the relatives tell his name, you just look it up on the electronic medical record and okay, it's a 50-year-old guy, has heart disease, has diabetes, and he also had a history of stroke. So you get all the history. But the downside is, in India, if it's still more of paper charting where you write the history on file, or even in OPDs where you document, your history is pretty brief. Okay, patient has come for hypertension. You take this in the crappy handwriting we are fond of developing and we give it. But in US, it's more elaborate. You have to type each and everything. And the notes become really long. That's why in an OPD in a government hospital in India, where you see 50 patients in a session, in US, you see max 6 as a resident, 6 or 7, because you have so much documentation to do. So it can be a pain in the behind in that way. Otherwise, so that's, and one major difference in US versus India is US has a lot of social work involved. Now, if you get a homeless guy in India, you treat him and you send him back to his home on the streets. It's not good, but there's only so much you can do for that guy. And if someone's poor, if they come from another state, if you don't have treatment, you just say you don't have treatment, you send them out. It might work differently in private hospitals where you get more well-off patients and they can go to different hospitals. But in US, all of these patients, they won't be sent back to the streets. They'll be kept in the hospital and there's a service called social work. They find shelters for them. If they can't afford medicines, they need to find places that can give medicines to them for cheap. Or we have to find a nursing home and we have to make them go to a nursing home. So it's a lot of logistic issues involved in social work. So that's a unique part in US. Of course, the work environment, it depends on where you train. The hierarchy is less. As you know, in India, you do have some professors who really, treat you like poo-poo, but in US, it's less obvious. Most centers treat you well, and it's a more friendly atmosphere. But pressures are there. You will feel the pressure. Residency is busy, PG is busy, so it can get to your nerves, but it's okay. You'll survive. Okay, so I'm running short of time. Now, briefly, I'll talk about research for a couple minutes. Now, of course, US has the greatest opportunities for research. This is a huge country. You have many universities, all of whom have free access to multiple international journals. So when you're writing a paper, you need access to a lot of journals so that you can reference them and cite them. And you always have one or the other expert in a field, or they have links to experts in the field. So you can always collaborate and write papers. Not all centers do have experts. Now, I am in a research institute, NIH, which is filled with a lot of pioneering experts. Now, for example, genetic code, Nirenberg, I hope you all remember that genetic code deciphering, it happened at NIH. So a lot of influential people here, and Anthony Fauci, whom you might have seen in the news. Yeah, he comes and drinks coffee with me. So yeah, just kidding. I mean, he works in my institute. So there are lots of influential people in many big league institutes, but even other institutes have people who would have contacts with people who do research. So there's lots of opportunities for research here. So one point that I would like to make is if you're coming for research to US, make sure you get a publication. Now that adds a lot to your CV as an international graduate. Now, because we're running out of time, I could talk much more about all these things, but I'll just hand over the stage to Sachin Bhagvan so that he can talk more about things that are more important to you in the immediate future, which is USMLE and ECFMG. And I guess, Sumant, maybe we can answer the questions later if I'm getting some questions in the chat box.
Yeah, sure. After Dr. Sachin talks.
Yeah, okay. All right, Dr. Sachin, the stage is yours.
Yeah, thank you so much, Dr. Sriram. One more thing I want to add is we use NIH stroke scale, which was also developed in your institute, which we use for stroke as well. So I will try to screen share this, just 1 minute. Can everyone see the slides?
Yeah, can you make it full? Yeah, it's perfect. Yeah.
Okay. So I'll talk about the road to residency as to what are the steps you need to take, what you need to keep in mind, because this is a long process. It's like a marathon. So we need to have each and every piece ready by the time we apply. So, oops, okay. So the first question that everybody asks me is that is USMLE different from Indian exams? To this question, I always answer that's both yes and no. No, because it's the same amount of matter that's been tested on USMLE, but the pattern of testing is completely different. So USMLE has a series of steps. It takes into account multiple formats of questions, which has more application based as compared to Indian exams. So coming to the components for a match, I feel that these are the 5 components that we need to really keep in mind before you go for before you apply for residency. So first is USMLE steps. I'll talk about steps in detail as to how much time they take and what to prepare. After the steps, typically people go for doing some clinical rotation to have some US clinical experience. And this has been found out through NRMP matches that US clinical experience also holds a vital role in persons matching and not matching. Third thing is about research. Research is only limited because of your visa restraints, because of time restraints, which I'll talk about as to how to improve your CV with these kind of research. Then you focus on your applications and then you give your interviews. After your interviews, basically you have a match. So coming to the steps, everybody knows this. It has 3 steps: USMLE step 1, step 2 of clinical knowledge, step 2 of clinical skills, and step 3. So coming to step 1, this is typically a 1-day exam. It has 8 hours of duration, has 7 blocks. Each block is kind of 1 hour. They give you a 45 minutes break, which you can take after each and every block. Number of questions, they vary, but maximum questions they have is 40. And they test usually basic subjects like anatomy, physiology, biochemistry, or first and second year subjects that we study in medical school. Now, the reason I put this slide on is we have a 3-digit score for now, but from January 1st, 2022, this is going to change to a pass or fail. Now, this will have a big impact on international medical graduates because USMLE step 1 is the deciding factor, as it's the benchmark that they distinguish between the American graduates and the international medical graduates. Now, if they make this pass or fail, then again, it becomes very difficult to distinguish, and hence a lot of emphasis would be laid on other aspects like your clinical experience, like other aspects of your application. So coming to CK, again, it's similarly 1-day exam. It's just 1 hour more than step 1, has 8 blocks. Each block contain about 40 questions, and total questions are about 318. This will continue as a 3-digit score. This is not going to change anytime soon, but many American graduates who apply, usually they would have taken their step to CK and their score would not have come, or they might not have taken at all at the time of application. So this exam, even though it's very important for us for applying, it becomes really a less of an significance when you are graded against American graduates. So coming to CS, I feel this is the most important exam of all. And I feel that this exam is most neglected by all international graduates. So just to go up into the exam, this uses like a standardized patient. So there will be a patient encounter where you will have to go and you'll have to talk. And then you will have to try to decipher as to what's going on and then come out. So basically it's they have 12 patients, and out of that 1 or 2 are not scored, but you do not know which are they. So you have to focus on each and every encounter and take it very seriously. It's usually a 15 minutes encounter. So in this 15 minutes, what you do is you introduce yourself, you take a focused history, a physical examination, and closing the encounter is very, very important in this exam. Because if you do not close the encounter in 2 or 3 of the standardized patients, then you have a high chance of not passing the exam. So what do you mean by closing the encounter? So closing the encounter means that you need to talk about what you're going to do, what are your differentials, and you need to explain that in layman terms and not in medical terms, and have some time in the last part for their questions to answer them. So if you do this, you get a little higher scoring as compared to if you do not do this. So you may have a telephone visit instead of a patient encounter where you just talk on the phone, take history, and then try to try to find out what's going on and try to close the encounter. And then after that, you have 10 minutes to write a note on. So this patient note is very important because we in India, as Dr. Sriram Gubbi mentioned, that we do like paper charts and we are not well accustomed to typing your typing rate. So it's very good to have this practice, and especially the website. I think it's the I don't know which website, but it gives you a free encounter where you can type and practice as much as you want. So this has 3 components of scoring. Okay. The first is communication and interpersonal skills. So they see how you approach the patient, how you talk to her or him. If they get mad at you, you don't have to, retaliate. You just how you handle that situation. That is all taken into encounter. Your spoken English proficiency, typically for us, it's not big of an issue, but if your pronunciation is a little odd and if they are asking very frequently as to what you're saying, then that might be a component where you need to focus on. The third one is integrated clinical encounter, which actually is the least of the important here. This will encounter as to how you take history and what diagnosis you give, and also how you approach to it. Like for example, if someone having chest pain and you don't include myocardial infarction in that, that will be scored negative against you. So out of these 3 components, the first 2 components are evaluated by the proctor or by the standardized patient who is there. It's not done by a doctor. The third component, the patient note, as well as the content of your differentials, is taken account by the physician. But again, the initial part where you do the examination, your percussion, your auscultation, and your washing your hands and other things, that are all taken into consideration by the standardized patient. So they score you. So most of the scoring is done by those standardized patients, and hence you need to be very careful and need to be very smooth with them so that things don't go against your way. So this exam, I feel, can decide in favor or against, because even though you can have multiple attempts on this, but even if one time you do not pass this exam, it goes a long way to prove that you're really good and you can be a good resident. Americans take this exam very seriously. They ace it because that's the way they are taught. from the first and second year. But for us, this is completely new. So you need to have a lot of time to practice and need to be very confident before approaching this exam. So coming to the next step, this is USMLE step 3. This is not mandatory for application, but it usually helps with your visa. If your program is sponsoring H1, you can directly go to H1 as this is a licensure exam. So this is a 2-day exam. Your first day has some MCQs that covers basic sciences, biostats, your interpretation of medical literature, medical ethics. Typically, they have 6 blocks, 45 minutes each, with 38 to 39 questions in each block. Your second day has a few MCQs in your part 1, where based on diagnosis and next step and management. Then the other part is something called computer-based simulation, or CCS, that is clinical case simulations. So these are simulations where they give you an encounter and they want you to find out as to what's going on through clicking of various history part, your imaging, your diagnosis, and see how they are doing and everything. So this is usually a 10 or 20 minutes encounter, but virtual time inside can run up to days. So total of 45 minutes break you get in the whole day, and you have some tutorial time which you can skip if you know how the exam goes. So coming to the next part of this puzzle is the US clinical experience. Now, US clinical experience, you can have 3 forms that you can do. You can do something called clerkship, externship, or observership. Now, clerkship is completely reserved for people who have not graduated. They're still students. So they should be the one who will be eligible to do that. Externship and observership, both students and graduates are eligible, but graduates are not eligible for clerkship at all. So clerkship is the most, this is the most valuable of the rotation that you can get in US. So because the responsibilities would be to attend rounds, to take history, present them. In a nutshell, you have direct patient encounter. Externship, you can also do the same thing. They give you some hands-on experience, but observership is completely hands-off. You cannot go and examine patients. You can take some history if you're attending, or if the person who is shadowing, they allow you to do, but that's the only role you have there. So clerkship, most positions are offered by university hospitals. Now externship, they can be in some universities and some in private practice, but observership, again, you can have both in university and community hospitals. As I mentioned, you will have hands-on experience in clerkship and externship, but observership, you won't be having that much hands-on experience. Clerkship can become more expensive. It depends on the program again. Some universities have an affiliate with Indian colleges. So those, there is some collaboration and hence less money involved, but there are few which they charge exorbitantly. Externship particularly is also expensive because most of the time you need to go through third party to get these opportunities, and that can cost you money. Observership can be free, can be expensive as well, but observership basically means that you're shadowing, you're not involved in any of direct patient care. So most of the places, they give it for free. In a few places they charge you, but it would not be such a big fee. So it's difficult to get into clerkship because again, there is huge competition, and step 1 score is already usually the filter. So as soon as you give your step 1, you need to start talking to the programs. You need to, plan in advance, because this usually takes at least 6 to 8 months before you get clerkship. Externship is very difficult to find as well. Personally, I could not find any externship and I didn't want to go to third party. Observership is comparatively easier to get. If you have contacts, you can just directly come and try to observe. There are few universities who offer observership for a money, and it's like more systematic. They give you access, they give you everything, and that really helps. So clerkship typically is a 4-week rotation, and after 4 weeks, you have to change to a next clerkship. And that usually affects in your letter, because whoever writes the letter will have just a very few days you rotate with, and hence not knowing you too much. Externship also is usually 4 weeks, but also it depends on program. You can extend depending on the program you're talking. Observership is usually a little longer. Some offer 3 months observership, like the one I did in University of Missouri. And this is really good because if you are with one same attending most of the time, you develop a rapport, and hence it really helps with your letters, which they mention that you've been working with them for about 3 months, 2 months, or 4 months, and that really helps. So coming to the next part of this puzzle, the research. So there is limitation as to how much research you can do. So these are some of the research where you can participate and you can quickly publish them. The most easiest ones are the case reports, and case series are better than case reports. Review article is easier to publish and it holds a really good value in your CV, but it takes a little longer time to write, to research, and to try to take topics. Book chapters are also really good. If someone where you're either rotating or doing observership has books and they give you opportunity to write a chapter on that, just grab it. It's really good. It also takes a lot of time, but it's really worth it. Can do basic science research, but it takes a longer time to get published. So I was involved in basic science research when I was here. And trust me, it takes about 9 or 10 months. The research that I did when I was doing my observership got published when I was into residency. So you need to keep in mind about the timing as well before deciding as to if you want to really go with basic science research. Clinical trials are usually not allowed in observership, but in clerkship you can get involved and then you can also remotely work with them. But observership typically do not involve because of legal issues. So one thing I really wanted to emphasize, and I've seen this a lot of times, that people ask me at what type of research I should do and what will fetch me a seat. So it really doesn't depend on what type of publication. You just need to show that you have some interest and you want to do this even in your residency. And it also gives something to talk about when you are in interviews. Like if you publish a case report or a book chapter, it really becomes an ice-breaking issue. Like, oh, I was thinking about this, I was thinking about that, and how did you write, what is the content of it, and it really starts developing a rapport with the interviewer. So it really doesn't matter what you publish. You can publish as small as case reports in any journal. It doesn't matter, it has to be an impact factor journal or it has to be like a high quality. They just need you some research to do so that they know that you're really interested in that. So coming to the application, typically you give all your steps. You give your step 1, step 2, CKCS, okay, and if possible, step 3. Um, LORs is one of the most important after step scores, is what I feel. And in most of the interviews I go, people talk about my letter of recommendation, telling, hey, this was really good. I'm really impressed at the way you worked there for this many days. So it really makes a huge difference to have a very good LORs. So if you come to LORs, university LORs are much better than community program LORs. Higher academic ranking officials, if you work with like program director or you work with a professor, that will have a little more impact. Personalized letters are much better as compared to general letters. And one way to see if you can get personal letter is to work more with them so that you can develop more rapport. You have a lot of connection with them, and then they can give you like a personalized letter. And working for the same person for longer duration definitely would fetch you more LOR or more better LOR as compared to just a general LOR. So the next important step is personal statement. This is a statement where you write as to why you want to do residency in US, and then what hurdles took you to come here, and then how are you as a person, and what are your limitations. And if there is anything on your CV that goes against you, like you have an attempt in either of steps or step to CS, then it gives you a good point where you can talk about it as to why it happened, and at the same time trying to find out if you can get over it, and that quality is curb-sided. So a good personal statement may or may not fetch an interview, but a really bad personal statement can definitely go against you. So you need to be very careful when you're writing personal statement. You need to give a lot of time, thought to it. Make sure it doesn't have any errors. Make sure you don't make bold statements saying that that this is the program I really want to go in, and this is the profession, or talk bad about other specialities. So that really reflects you as your personality, and then it really works against your favor. So make sure that your personal statement is more embedded with your optimism, your good thinking, and trying to sell you out basically. So this is the picture I took just from my book. It just gives you a timeline as to how you should prepare. So ideally, it's better to have your step 1, step 2 CK before your match year. So if you ask me, I would recommend you to give your step 1 first, then step 2 CK, and then step 2 CS in the order, because it really helps, as step 2 CK builds on your step 1 knowledge, and then step 2 CS is much better if you have a clinical knowledge, so that you don't have to worry about the ICE part. So in January, February, March, you should really think about booking your step 2 CS, because it usually takes a long time to get you a slot, and the results also take like 8 to 12 weeks. So you need to make sure that your results are before applying. So try to book them early in Jan, February, March, where you'll have more slots, as most of the American graduates would not be thinking of giving step 2 CS at that time. It is a good time to start working on your CV, your personal statement, and also try to look for clinical experience. I would recommend, even during your steps preparation, just look and try to make sure you have one before you come for CS exam. So April, May, June, it's more about getting US clinical experience, trying to do more research, trying to publish. Then usually you get ERAS token for residency, which is for the match in the month of June. And make sure, if you have not taken your step to CS by then, to try to schedule it in these months. July and August should all be about getting other documents like MSP, that is Medical Student Performance Evaluation. In our colleges, they have a standardized format. You just go get it and make sure it's uploaded. You make sure you authorize your USMLE to release your scores. You start researching about the programs where you would like to apply, and basically seeing whether you're eligible in that program in the form of visa, sponsorship, what are the score eligibility, how many letters do they need, and all of the sorts. And if you have not taken your ERAS token, take that during this month and start collecting your letters of recommendations, because once you finish your rotation, you are out of the system, and out of sight is out of mind. So make sure you keep in touch with your mentors and ask them regularly, and make sure you start collecting them in the month of July and August, so that it takes at least 2 to 3 weeks for your letter of recommendation to be uploaded. And again, it comes in 2 forms. One where you waive that you have not seen the letter. That has a little more significance than saying that I have seen this letter. So you need to guide your mentor as to for them to upload themselves rather than you taking the letter and uploading. So in advance, try to ask them in a polite way to to try to give you the letter. September is the time when your ERAS application opens. So you should make sure your CV is ready. You should make sure all of the documents are ready. Your step scores are already released. And then you have to apply by September 15. It's not a hard and fast rule that you have to apply on September 15, but usually application scrutiny goes as first come first basis. So it's always better to have it early on. NRMP registration also opens for the match. Just take a token, pay the fees, and be ready with that number. October, November, December, January is the interview season. This is a time you can either do research or you can do step 3 if you want H1B visa. And also result takes 4 weeks. So keep that in mind, and your result should be there before the match date. So make sure, if you want to give, plan accordingly. February is usually the time when all the interviews are over. You can just create a rank order list and you submit to the match site where how you want your preferences. March is usually this March second week is usually the time when you get the result. And then if you don't match during that time, there is something called supplementary offer that is called SOAP. You can apply for that. April, May, June is all about obtaining paperwork for visa, attending visa interviews, and then orientation in your program. And your residency starts from July 1st. So coming to this year's match results, it was a little promising. There were a total of 45,000 applicants that applied this year. This includes all graduates like international medical graduates, American graduates, US international medical graduates. They had a success of 80.8% of match. For IMGs this year, there were 12,000 spots taken with a 61% match. So this has been a really promising match year. And this is one of the highest percentage of match you have seen as compared to previous years. So a lot of people ask me another question that, which specialties you need to see for applying into residency. Now that is a loaded question, and that's usually a tricky question because, nobody wants to talk about that, but I'll be very frank. Americans, they usually love two types of profession. One that makes more money, or one that has a laid back life. So surgical specialties are more driven, as American health industries is more procedure driven. So all surgical specialties are really high competitive specialties. For IMGs this year, most matched was internal medicine, followed by family medicine, followed by pediatrics, then neurology, and then pathology. So these are the top 5 specialties that worked in favor this year. Again, by me saying this, it doesn't mean that we don't have anybody matched in radiology or dermatology, which are kind of a higher specialty, but it just means that most of the graduates prefer to take this, and there's a high chance of matching in these. So that is the end of my presentation, and I'll be open to any questions now.
Thank you, Dr. Sachin. That was a wonderful presentation. And Dr. Sriram, I'm sure I know you felt 10 minutes was too less. It is actually too less, but still, thank you for sharing your experience and your journey. So let me first begin with some of the few basic and the most common questions that people usually have. What is the ideal time to start preparing for USMLE, and is it ever too late? I mean, is it always supposed to be during MBBS or right after MBBS, or can you also take it after your MD? So, Dr. Sachin.
Okay. So you can take USMLE anytime, okay? But you need to make sure that, you have a lot to lose in those preparation time. So the best time would be to definitely give during your, during your med school or during your college. That's the best time because it gives you maximum chance. Now, so for international medical graduates, typically 5 year is like a cutoff that they usually put. After that, they are usually termed as old IMGs. Now you have ups and downs for old IMGs as well. There are programs that definitely take them. And there are few programs that they do not want old IMGs or experienced IMGs that I would like to call them. But as year goes by, your chances of match decreases. Okay. So if you are 5 years or 10 years down the line, your chances of match would be lesser as compared to just freshly graduate out of your college. Having said that, it is never too late. It's all about building your CV and getting good letters of recommendation, trying to have a research. And if you have already done like internal medicine or any other specialty and try to apply the same specialty, you can sell yourself saying that you're already experienced in that and you don't need much training. So people would be very happy to take you because they know that they don't have to rely on themselves, or they don't have to be supervising all the time. You can take care of the load on your own. So you have to spin your personal statement. You have to spin your CV in that particular format. But usually if you take USMLE and try to apply within your first 5 years of graduation, there is really high chance of match.
Okay.
I mean,
thank you. Thank you. So Dr. Sriram, this question is to you. I mean, we all talk about, chances of getting matched this year or next year, but what happens if you don't match? What are the alternatives? Does it just end? Does your life end there? Or can you just reapply next year, and what you can do in that 1 year?
I think you can certainly reapply. There is no hard and fast rule that if you don't match this time, that's it, pack your bag or stay in it. It doesn't mean that you can definitely apply as many times I don't know if there's a cutoff or how many times you want, but definitely you can apply for a second time. In that time, of course, the best thing to do would be to do some research. Now, it's always tricky to do research because one, you need to find a mentor who can guide you for an entire year. And two, it's a lot of money. You have to leave India, come to US, stay for a year and do research. So there are lots of challenges involved. So what you have to do is try to do some research. Clinical, yeah, I mean, if you have at least 3 months of clinical experience, whether it's observership or clerkship, that's good. For residency or even fellowship, people want to look for research. So it's better if you do some research, any type of research, clinical or basic science, preferably in US. But if you don't have the money to spend, to be here for a year, then it's okay to do research in India too. So you just have to show that you're still active. And one way to explain why you didn't match in the previous year and why you are applying now, your personal statement would be a good place to mention why you didn't match. It is rare for someone who's applying for common specialties like internal medicine or pediatrics not to match. It is relatively rare. You might go unmatched if you apply for tougher specialties like general surgery. And even for general surgery, you need lots of research and you need to have really high scores in the steps. So surgery is extremely competitive. I can't say it's impossible. It's extremely competitive. You need lots of research. And surgical specialty can be malignant. The people can be pricks. People will yell at you. You'll be surprised that, oh my God, this happens in US. Yeah, the surgeons can be pricks. You'll be treated like trash. So that's the difference. Surgical specialties are a bit chilled out in India for some reason, but here surgical specialties are brutal. So keep that in mind. But that's the point. I mean, I just digressed into surgery because someone was asking a question about that in a chat box. So I'd say you can apply if you haven't matched, but you have to prove why you're still worthy by doing more research during that time.
Okay, thank you. So talking about finances, let's talk money. Dr. Sachin, could you please elaborate on what the cost could be of the entire process until you get into residency?
Yeah, that's really a point that you need to consider. So steps are usually around $800 to $850. That comes out roughly around 65,000 rupees each step. Your step 2 CS is a little expensive. It comes out to be around $1 lakh or so. Overall, for me, it came out to be around 20 lakhs totally, and this included my observership. I was living in a college town or university town, which is not very expensive. But if you live like Dr. Sriram Gubbi lived, like New York, it becomes really expensive. And those costs have also to be added. But around 15 to 20 lakhs would really be a good amount, for your steps. But it again depends on where you get your observership, how much programs you're applying, because each program will cost you around 1,000 rupees. And typically IMGs apply for about 200 programs or, more than that sometimes. So definitely cost should be kept in mind. But these steps are like 650 to 60,000 rupees. And, about 20 lakhs would be a good amount.
Okay, so based on even my experience, I would just like to list out and correct me if I'm wrong. All the steps together cost around, say, they have increased the prices now. Step 1 is around $1,200.
Oh, really?
Step 2 CS is $1,600. So altogether, it comes around $4,500. That's just the exams. Then you have different resources, books, and also you come to the US for your electives. There are observerships. So observership, as you said, is cheaper. So I've seen people who do electives, which cost $3,000 to $4,000 for just 4 weeks. That's the norm right now. So considering three months, that's again like around more than $10,000 right there. So living costs are around 1,000 for rent, 200 to 300 for miscellaneous expenses, daily expenses. Then application around $3,000. So like you said, around 20 lakhs.
Yeah.
So it's quite expensive. Anyhow, do you anything else to add, Dr.
So
Sachin?
one more thing that you can try to curb your expenses is what I did for interviews. It really helps you to have an international license, or at least you can, if you can drive in US, you can save a really lot of money. For almost all my interviews, I drove because flights are expensive. If interviews are in remote places, it really becomes very expensive to those areas. Whereas renting a car and going driving through becomes really inexpensive. And also, if you can find someone who stays nearby, you can try to stay with them. Try to curb hotel costs. I usually preferred Airbnb because I had a car, so I usually went somewhere which was good, but it was also economical. So that's also one way. If you're planning to come for interviews, make sure you have your international license. Few states require that. Few states you can drive on your driving license. So if you can just practice with some of the friends here of how to drive, becomes really really convenient for for future aspirants to come and go for interviews.
Thank you. So talking about interviews, so there's a recent change. Also, we have a question regarding this. That Step 2 CS has been suspended for current like 12 to 18 months. So this cycle, this NRMP 2021, they are accepting alternatives that's published on the ECFMG website. And also, instead of Step 2 CS, they have come up with this OET. I mean, it was always there in existence, occupational English test. So that's the alternative right now. Just wanted to put it out there because there was a question regarding this, and no one knows for sure what's going to happen after 18 months. Like if they feel that CS wasn't actually serving the purpose and this alternative is good enough, they might continue doing this or bring back CS. There's no clear verdict on that, and even the interviews might go virtual. So that's benefit this year, that people might be saving some cost there. So next, Dr. Sriram Gubbi, a question to you. What are your views on, a lot of people discuss about university program, community program, and just community program. What does it mean for your future, and how does it really impact you when you're, picking your place for residency?
It depends on what you want to do with your life after your residency or fellowship. If you want to settle down, have a practice, or just work in a hospital, make money, if that's your goal, it does not matter where you're trained in, whether it's university or community program. But if you're someone who is interested in research and want to work in an academic setting, in that situation, maybe it matters. If you want to do research, if you're from a university program, it would be better because university is affiliated to the medical college, and you'll have access to a lot of clinical as well as basic science research. But even being in a community hospital, you can always try to do research because community hospitals have some sort of clinical research going on. They might not have hardcore basic science research. You can still do research being in a community setting. And honestly, if you work really hard, even being in a community hospital and get some research during residency, if you apply for fellowship, you'll get matched anywhere, be it Harvard, NIH, Stanford. You can match anywhere, so that's not an issue. For residency, if you're trying to match into residency, if you have university letters of recommendation, that is probably better than a community program. But then again, it's not about where your letters are from, it's about the quality of the letter. As Sachin was mentioning, it should be more personal. They should mention that you are an exceptional candidate and you're really good and you stand out among your peers. So it's the quality of the letters that matter rather than where they're coming from, whether it's university or community. So bottom line is, if you want to do research, try to stick to university, but if you have limitations, you will do fine if you are good, whether you're in community setting or a university setting.
Okay, thank you. So Dr. Sachin, over to you. You mentioned about observership and electives and externships in detail. Could you just elaborate on how can someone get observerships? I mean, clerkships are usually through their programs, which is easily available on the websites. You apply, and if you get in, they send you the details and you fill it up. But what about observerships? How do you go about it?
So observership, yeah, it's a little tricky to get because there is no standardized procedure to go for. So it all depends on contacts, first thing. So if you have any US contact who is a physician there or a resident, you try to approach them and try to make more contacts with them. And once you have their contact details, you just email them. Okay. And again, your email should not be like a generalized email. You should try to specify as to why you're interested in that and send them. I'm sure you'll get a lot of rejections, but the key is to just go on. Few of them they do publicize over the internet. So if you can search the list of observership programs, sometimes that gives you a list, and then you can go to individual pages and then try to approach them. Observerships are also becoming very competitive right now. Like I remember University of Miami has this observership, $1,000 I think for 4 weeks, or $2,000 for 4 weeks, I don't remember, and their wait time was at least 6 or 7 months. So whenever you're trying to prepare for step 1 or step 2, it's the best time to spend a part of your day just to research about your observership and send emails. So I got observership through contact, and I also pestered Dr. Sriram Gubbi a lot during my time, and he also helped me a lot. So it's all about contacts, developing contact, going through, and definitely you will get somewhere. It's not that you're not going to get it all, but it's all about the time and the frustration it takes. Unfortunately, this is the only way you can get. I think there are a few agencies that do provide with observership. They help you get that area. Again, it's expensive, and the quality again depends on whether you're getting into university or community with through them. So if you are not if you're out of options, then definitely that would be the next step you can take. Try to contact them, make sure you get some kind of clinical experience in US, because without US clinical experience you will not get US letters, and that kind of puts you a little off back as compared to people who already have that. So it's become a norm nowadays that to have this experience.
Yeah, and I also would like to add that, usually when we talk about sending emails, it's supposed to be, I think, around at least 800 to 1,000 emails. You just randomly send them out. And if you're lucky, you'll get 20 replies, of which, 15 are going to say, sorry, we don't have a slot. And if you're really lucky, you'll get 5 positive response. So that's something. And next question I think we'll take from the audience is regarding research. We have Sharanya who says that, the research as a parameter for your application has been set low by some program directors, and volunteering and social work, that kind of thing seems more appealing on a CV. So what's your take on that, Dr. Sriram?
I had when I applied for my residency. I had over 20. Actually, no, I had 0. I had no publications. So I had absolutely nothing. My research background was 0. The only research I kind of had was I was sort of part-timing at St. John's in Bangalore, where I used to go to a lab and meddle around with some basic science equipment. I got no publication out of it. So no one cares about that, honestly. So as I mentioned, research. So the research is important if you want to get into a highly competitive place. For example, Cleveland Clinic and Southwestern, these are big league universities. They offer seats for IMGs. So if you want to go there, you need research. That's one thing. You need research if you are getting into a tough specialty. surgical specialties, you need research. If you don't have research, then they throw your application into the trash. But when it comes to medicine, pediatrics, psychiatry, neurology, research, as whoever mentioned in the comments, it's actually pretty low on the list. What matters is number one, your letters of recommendation, as I mentioned. They need to see how your letters are. If your letters are really good, then it's highly likely they'll match you because they know you're an international graduate. You don't have several thousands of dollars to get research opportunities. So they know the limitations. So they expect you to excel in the fields that you know you have opportunities to excel, like your USMLE scores. You need to have really good scores. If it becomes pass or fail, yeah, I mean, then you're kind of screwed. Then you have to do research and all of that. But we'll see. That's 2 years from now. But you need to have great scores, both in step 1, step 2 CK, step 2 CS. You need to pass it in first attempt. Second attempt, it's not a done deal, but first attempt, you have, that's what's important. And great letters of recommendation. Research only for top-notch universities and for tough specialties like surgery.
Okay, 1 second. So thank you. So this is one of the major questions that's being asked about surgical branches, whether it's a good option to take up USMLE or go for PLAB or Indian exams. Even I was in the same similar condition, initially I wanted to take up surgery, but then Dr. Sriram told me that wasn't a wise option. And then also I started.
Dude, I didn't discourage you from taking that. Come on, it's your choice.
But then personally, I too started liking internal medicine. So Dr. Sachin, if you would like to throw some light on this as to, I have heard people get into surgical branches, say they, after the MBBS, they get into research or do PhD for 2 to 3 years and then get to know the mentor, publish, and that's how they get into surgery. What is your personal view, like from what you've seen in the US?
So as Dr. Gubbi mentioned, that these are competitive specialties. That doesn't mean that you will not get through it. As he mentioned, it has to be excellent scores. Attempt first, no attempts on your any of the exams. You should pass your CS in the first attempt, and importantly, you should have research again on that. So I have not seen, but NRMP does give some numbers, okay, as to how many people match. So it's not that IMGs do not match in general surgery at all. The question you need to really ask yourself is, am I willing to put through that much of time and energy to obtain that particular specialty? Because there is also a chance that you might not get into those specialties. Now, so many students do come to my to neurology rotations, and half of them, they do want to go for surgical specialties. Again, as I mentioned, it's procedure driven, so money is there in that field. So most of the Americans prefer that. And again, once an application comes, it doesn't matter if an American has a research scores, even a little lower score, they get preference. It's not said out loud, but that's what happens everywhere. Visa requirements also need to be seen, because there are few programs who do not take J1 or H1 visas. So keeping all this in mind, it really limits the number of positions you have. But again, there is no zero position. So definitely, if you really want to do it, then you have to have a plan. You need to find someone who will really guide you, who is in that same specialty there, who can hook you up with different mentors, and try to get research. Even from India, it's fine. You can collect data, you can start publishing, writing reports, all those sorts. So, but you need to focus on that, make sure you have someone and plan in advance, and be ready to sacrifice so many years. At the same time, keep in mind that this might not work in the future, and then you should have a backup as well if it goes south. So that's my take on that. Otherwise, I would not say it's completely impossible. I have a few friends who are surgical residents, who are little senior, who have been in US for about 10 or 10 or 15 years, before. So that time it was not that competitive, but now it's really become competitive. And you should keep your mind open when you go in, is what I would say.
Okay, so just another important question, to both of you regarding visas, since we're talking about it. What particularly, are you looking for when you're applying for a J1 visa or a H1 visa? What are the perks? What are the demerits? And how and why did you choose your category? First, we'll start with Dr. Sriram.
The type of visa, I think it matters based on what your long-term goals are. If you plan on returning to India, then J1 is an easier visa because J1 is an exchange visitor visa. Now, J1 gives you 7 years, and the advantage of J1 is you can apply to many more residency programs. And even in the future, if you want to do subspecialization, that is fellowship, you can apply to lots more fellowship programs. And you can return to India after this. But J1 actually, in the bigger picture, is the weaker visa compared to H1B, because J1, it's a hassle because you need to keep renewing your visa every year by going back to India. And second, if you want to continue to stay in the US, you can only do it if you spend, I think it's 2 or 3 years in your home country, or if you work for 2 or 3 years in a godforsaken place in US. You have to do rural service in US for 3 years to get off of J1. That's the caveat with J1. H1B, that's the work visa. So that for that you need step 3. Without step 3, you cannot apply for H1B. The advantage of H1B is you don't have this J1 return to country every year policy. Your H1 is there for 3 years, and you can stay in the country and you can extend it by 3 years. So H1B is there in total for 6 years. J1 is there for 7 years. The problem with H1B is there are much lesser programs that offer H1B. Like probably half of the programs compared to J1. And that's the same with fellowship. But with H1B, if you want to immigrate to US and stay in US, H1B is a much easier visa. There are much lesser hassles. There are many subtle nuances to it. We don't want to go to that in this session. It's a bit complex. The whole visa business is complex. But keep in mind, if you have long-term plans of staying in US, H1B is a good option. Clear your step 3 for that. J1, if you want to return back to India, then J1 is a better option. But keep in mind, guys, the current US political scenario, it's targeting H1B pretty badly. They want to scrape H1B or limit H1B they're making drastic changes. I don't know how it will affect the medical community, but keep in mind, especially if Trump stays on for the next year, he might make some drastic changes to H1B policy. But you can always come on J1, and there are ways to work around. So even with J1, if you want to stay in US, you have to go through those 3 years of rural service, and then you can stay in US. So there are ways to work around, but these are the pros and cons of J1 and H1B.
Okay, thank you. Dr. Sachin, do you have something else to add, or was it something similar to Dr.
No, it's
Gubbi?
very similar. As mentioned, if you want to do fellowships, which most of us want to do, if you're coming to US, I would prefer J1 visa, because you get a lot of options. And then once you get a fellowship into a very good place, then your life is made. You can get job easily wherever you would like later on. So I would prefer being on a J1 visa because of two reasons. One is definitely lot number of spots, And second, even the rejection rate of J1 is very less in Indian embassy there, or US embassy in India. So if you go for visa interviews, your H1B, there's a chance that you might get rejected. Um, and and again, you have to go through the hassle. But J1 visas, I have seen personally and even reported that, the rejection rate is very less because they know that it's up to 7 years, and after 7 years, you're bound to come back, or, it's a limited kind of visa. So if you really would like to settle in US, and H1B is a much better visa as compared to J1. So if you're really planning to do that, I think step 3 should be the best to be given before applying.
And
Yeah, I think Sachin, you're on J1, right?
I'm on J1, yeah.
Yeah, okay, yeah. So Sachin's on J1, I'm on H1B.
H1.
Yeah.
So
Yeah.
yeah. So what I've heard and seen during my stay in the US is, like you said, rural service. It's typically not the rural service of India. It's supposed to be the underserved areas. Say even in Atlanta, even the Midtown or Veteran Affairs VA hospitals are considered to be waiver jobs. So that's something I would like to put out there.
That is
So
true. That
also,
is true. Yeah. And
yeah.
the rural is not rural in US. You will have a lavish lifestyle. So you will be minting money. So it's not like you don't have water to take care of your needs. You will be pretty rich doing rural service. So I miss
And
out on
yeah,
that. Sorry.
and one more thing. So here in US, if you serve in underserved areas or little small towns, you're paid more as compared to if you serve in a bigger city. And cost of living is also less. So all in all, it works out. I would
Yeah.
not say it's very
True.
difficult to live. All in all, it works out. You save a lot of money. That's the second
Yeah,
point.
and you make like Sachin is talking about like 200, $300,000. So it's a lot of money per
Yeah.
year.
Yeah, that's a
So
lot. So I think we pretty much covered most of the important questions. So just to conclude, and as a concluding statement for someone who is, currently not able to decide whether to take up USMLE or Indian exam or is in two minds, what are just two bits you would like to convey to them so that, maybe they'll change their mind and take up USMLE, or, finally get an idea of whether USMLE works for them or not? First, let's start with Dr. Sachin.
Um, I do not know how to answer that question because Indian exams are more competitive in the form that their question format, and the amount of syllabus or amount of topics you need to cover is really very high. So definitely, if you are not someone if you are someone who are more analytical, or you want to apply and you are good in application based questions, I think USMLE would be one of the options for you. Indian exams, even though they are really very tough, if you just sit for a few months, cram, you're done. Your life is done. USMLE again has to, you need to build your personality. You need to build contacts, and it's a different kind of struggle. So it all again depends on pros and cons that you need to see. Pros of in an Indian exam is it's short lived. You struggle for a few months and then you get into what you get into and you go on. If you are really very specialty driven, that I really want this and only this, I think USMLE might be an option for you because that gives you an freedom of selecting what you want and going towards it or working towards it. So it's like a swing. You just need to make the list of pros and cons, make sure you have everything weighed on before you decide. USMLE is comparatively easier exam, I would say. It's more logical, it's more analytical. So if you start applying yourself in these questions, I don't think it becomes really difficult to crack this exam. Indian exam still eludes me. I do not know if I even give it now, I might not be able to crack it because it's more fact driven, and you have a lot of numbers that you need to crunch on, which really does not help you in future. Second thing that you want to see is how you want your practice. So if you really want to be advanced, stay on the top, USMLE might be a good option because everywhere in US they really use some cumbersome tests and try to figure out what's going on. But again, if in Indian exams and in Indian PG, your again studies is more based on what you see. In a nutshell, what you read in Harrison, we apply here is how I would present that. So you need to keep your pros and cons ready before deciding USMLE. Again, it's not too late. I also tried to give Indian exam once, but then just after giving one time, I realized that this exam is not suitable for me. I'm more like an analytical person. I want to apply what I learn. So I switched to USMLE and it worked wonders.
Dr. Sriram, concluding remarks.
Well, concluding remarks, pretty much. It comes down to what you want to do. People who, a lot of people are in still lots of confusion. These are tough times for all of you because till now you are pretty much cushioned. Your path was cushioned. You finished college, you went to med school, and then what? You're on your own in the desert. So these are tough decisions to make. Whatever you make, just don't look back with regret. If you think US is a good option for you, if you want to do research, especially if you want to be in academics, and I won't recommend this as a solid option, but it's there if you want to make lots of money. US is a good option, but keep in mind, it's a lot of expenditure, it's a lot of uncertainty, especially given the ongoing pandemic. The political climate, yeah, it's question mark, it will calm down. I don't think that will be a big issue. But keep in mind, US and Indian PG exams have their own merits and demerits. If you have lots of obligations in India that would want you to stay back in India, then Indian PG is fine. I mean, Indian training is really good for what you need to do in India. US training is more tailored to what you need to do with people in US. So make up your mind and make the decision is hard, but eventually, if you have the financial support and if you're really interested and driven in research, USMLE is a really good option. And just as a part of this, I saw a few questions asking, can you apply for multiple branches? Yes, you can, but it's double the work for you. You have to make 2 personal statements, get multiple LORs, apply to many programs, and each of them cost. US is not cheap. These people charge you for each and everything. Yeah, so it's expensive, but the bottom line is, yes, you can apply for multiple specialties. But at the end of the day, it's your choice. Don't regret what you've done. Life happens. Move on.
I think we can all.
Dr. Sriram, one being neutral, one question many students have is which one to prefer, whether to USMLE, PLAB, or AMC. Some people have that doubt also. So, being a neutral candidate, what would you suggest?
Who was this question directed to? Sriram. Okay.
Oh, so I think Sachin can answer it if you want, or even I can say I don't know about PLAB, I don't know about AMC.
I also have a very
Sachin?
limited knowledge about PLAB, but I think that exam is a little more trickier than USMLE. I do not know. I might be wrong. So correct me if that is the situation. But I think cracking those exam itself gets tough, and even after cracking, you need to work there for 1 or 2 years before you get into residency and fellowship. So it's a long hassle for anybody there going there. But I'm not completely sure about how the exam pattern is. USMLE I'm well versed with, so I can talk about that part.
I
USMLE is better.
have a little, Dr. Sachin. I think I can speak a little bit about PLAB, because my visa was rejected for my clerkships. So I was considering PLAB as an alternative during the 1 year that I took a drop. So PLAB is an easier exam, I would say, because I have knowledge of both USMLE and PLAB. USMLE is 8 hours. It's energy consuming, time consuming, money, everything. PLAB is just 3 hours. It's like an Indian PG exam. The questions are similar to USMLE application based questions. However, first you have this English exam, IELTS. So once you get that, you're eligible to apply to PLAB 1. After PLAB 1, that's the only written MCQ exam. After that, PLAB 2 is a practical exam, just like CS. which can which has to be taken in the UK itself. And after that, you just apply to a job, basically, as a trainee, as a foundation year, work there for 1 year, and then you get into their specialization tracks and stuff like that. I'm not sure about the Australian Medical Council, but yeah, I think, in my opinion, PLAB is an easier exam, and it's can do it in 1 year. You don't have to spread it out. You don't have to do any internship or anything.
But do you know how the scoring is? Because I heard that only a certain amount of people pass the exam in the first attempt. I
Uh,
just got it, so I'm not completely sure if That's why I thought it's a little tougher exam than USMLE.
no, I have heard of people just study for 1 month and then gotten great scores.
Okay.
So
Okay.
it's not as competitive. It's just that getting a job is difficult. You have to just apply to vacancies, and if they have a vacancy and they like you, they just take you. So I think we can
Sumant,
wrap this
we
up.
have joined today's session. We are joined by great neurosurgeon Dr. Sanjay HM, all our beloved senior. You all know him very well. Our role model and inspiration. So hi Sanjay, can you unmute Sanjay? Yeah, Dr. Sanjay, are you there? He's a very close friend of Dr. Sriram Gubbi and all our beloved senior. Currently a resident of Neurosurgery.
Hey guys. Thanks for the intro. Kishan is like very good at hyping people up, but yeah, great job by the moderation, and of course Sachin and Sriram, are great as always. I had a though, if post. I don't know if this was covered because I might have missed it. Post MCH neurosurgery, which is what I'm doing right now. If I had to come to the US, are you aware of like what are the necessities and what is the kind of get in USMLE exams and how to go about that? Could you shed a little bit of light on that?
Hey, Sanjay.
Hey, dude.
Dude, yeah, nice to hear your voice after what, 5 years now? Yeah. So I think, Sanjay, US does offer isolated fellowships. I know people who have done PG in India and have come to do just super specialization in US. Now, for you, you will be a hot candidate of sorts because you are highly specialized. So I don't think that general rules apply to you, like letters of recommendation. Those need to be strong, but clerkship and all that, they can ease that out a little bit for you. But I think it depends on what you want to do. Are you planning to do neurosurgery residency or fellowship?
No,
like
post
post-residency
neurosurgery,
fellowship.
you have you have endoscopy or skull-based surgery or vascular, neurovascular.
Okay. Okay, so it's a fellowship. So I think fellowships are offered, but you certainly have to clear USMLE for that. So I think it's a unique process. There are websites in which you can look into where they offer super specialization, and just for doing fellowships and going back to India, it's doable. But if you have plans of staying in US without residency, it's really hard. You'll be walking on a thread. Because you would not be a marketable commodity in US if you don't have residency in US. But to do fellowship and go back to India, it's doable. But resources to find that, Sachin, do you have any information on where Sanjay can find resources?
It will be again depending on the fellowship. So I think putting the fellowship in and searching through individual websites for their eligibility would be a best option. I'm not completely sure of which fellowships can be done without residency in US. There are only limited fellowships in neurosurgery later on after neurosurgery that can be done without any residency in US. And as you mentioned, yeah, practicing becomes really tough. You need to have your residency again in here. Sometimes it becomes easy because once you do fellowship, you know people around there, you build contacts, you can do again residency. But neurosurgery is 7 years here, so that would be something you need to keep in mind again before applying. So I would recommend going through each and every website to see for eligibility whether they really require, board certification here in neurosurgery, or is it okay to apply from outside? Yeah, you can come, you can do fellowship and then go back. I think that would be the best option.
Right, thanks a lot, guys.
And Dr. Sumant, Dr. Sriram was mentioning about the importance of research, although he didn't have, but the importance of research in his CV. So you, as I remember, you have some 7-8 publications in your name already in during MBBS. So how does that help, and what you would recommend for your juniors?
Okay, so I have 8 publications totally, and I have 3-4 in line. There's 2 of them are have been submitted under review. So basically, I started right when I was in first year of MBBS. Like that's when I decided I had to take up USMLE, and that's how I tailored my CV to look after 5 years, how it should look. So back then is when I worked first year and second year during my vacations. I worked at Fortis Hospitals, Bangalore. So I found a really good mentor where we started with data collection. I mean, that's all you can do initially to understand what research is. You start collecting data. Initially, you don't understand what you're doing. Like, why is this project being done? What's happening? You read articles, and suddenly you studied all these 12th standard books, which are, so simple. And then you come and you start reading these articles, research articles. They just go over your head. But over time, when you start reading case reports and just start with collecting data, over time you start, the best thing that happened to me was I decided to go present some case reports and paper presentations at medical conferences. So that gives you a very good idea on how to proceed about writing an abstract, a manuscript. So once you start, that's my suggestion to all the students out there. You find these medical conferences which are increasing nowadays during medical fests. Go present a case, present a paper. Doesn't matter if you win or do not win. The effort and the research that goes into presenting it and making it happen, in the long run, it's gonna help you. So getting a research is not easy. Some people try to do these projects called ICMR. That's one way to go about during med school. Other thing would be to look for a mentor outside. Try to convince them through. It's all about networking, getting to know people, and showing you're punctual. So over the years, you can publish papers based on these. Another thing is when I went to the US, like Dr. Sachin was mentioning during observership, I was lucky to find a BMC alumnus in one of the institutes, and he gave me case reports to write. So I wrote those and submitted. So that's how, once you have one publication, it gives way to the next publication. The person next you meet is going to, have some faith in you and gives you a research publication. So that's
very well said. Very well said, Sumant. Okay. Once you start, you will get more confidence to do, and you'll get more interested into it. And once you get an idea, you'll be keep doing that. It's so addictive. Anyway, thank you so much for that inputs. And please continue that you want to. Dr. Sriram, okay, I'll do that. Dr. Sriram, thank you so much for spending this Saturday morning time with us. And it was really valuable guidance, to be frank. And many of our students will benefited by these inputs. And you also enhanced our confidence levels. Thank you so much, Dr. Sriram, for those. And also Dr. Sachin, my bestie. Sachin, thank you so much, dear, for coming out and sharing your experience with us. Hope to seek more guidance in the future as well. Need your guidance in the future as well. Thank you so much. And my dear brother Sumant, nothing to say. Wishing all the success in upcoming exam. And many have asked for your session as well in the future. After your exams, we may have a separate session, a panel discussion of this kind again for the future aspirants as well. Thank you so much, everyone, for joining. Have a pleasant evening.
It is a pleasure talking to you, Dr. Sachin. Dr. Sriram.
Thank you for having me.
Thanks for having us.
Bye-bye.